we're diving into a question that anyone considering a new health test should ask first. How accurate is it? And how worried should I be about false positives and false negatives? Reporting from beautiful Dutch Harbor, Alaska, I'm Doreen Lorenz. Dr. Sally, what should we know about the accuracy of the Gallery test?
Accuracy really matters. It's very important, especially when we're talking about something as high stakes as cancer. So, the Gallery test, first of all, is not your basic screening tool. It is very specific. It is the result of years of deep machine learning. It's been trained on thousands of samples of people with and without cancer, and it is trained to look for methylation patterns. Those are specific changes to the DNA of the cells that are shed into the blood that show up when cancer is present in those cells. So, one of the things that makes this test a game changer and so different is that it does not just look for one type of cancer like other screening tests do. It looks for dozens of types all at once that scale as complexity and precision. In clinical trials, this test demonstrated extremely high specificity. That means if it says it sees a cancer signal, it usually does. So false positives for this test are extremely low compared to our other standard conventional tests, such as mammograms and colonoscopies. False negatives, that's where the test misses something. They do exist because no test is perfect. But the gallery is especially good at detecting cancers that are rapidly growing and are harder to catch with other screenings. So it's not about replacing the testing that you already do. It is about adding something new and powerful that most people had just simply never had access to before. And that's a game changer. The key takeaway is that it's not just accurate, it's trustworthy, and it's improving every year as more data comes in.
That gives me a lot of reassurance, Dr. Sally, but I would imagine there's still misconceptions. What are the biggest mistakes people make when thinking about this test and how accurate it is?
Well, there are a few common mental tracks that we just all fall into. First is the myth of perfect. People assume that a test, any lab test, any medical test, if it's not 100% perfect, it's just not worth doing. That's not how medicine and risk works. Even mammograms and colonoscopies, things that are trusted, that are standard of care and have been for years, they miss things. They miss more things percentage wise than the gallery does now. And those screenings have been standard for decades. Second, people confuse detection with diagnosis. The gallery doesn't say for sure that you have cancer. It says something may be happening deep within your cells. That's the moment where further testing to confirm a diagnosis, like imaging or a biopsy or exam, comes in. It helps give your doctor a map to help you, not a verdict. And the third is just fear. Some people avoid testing altogether because they're afraid of a false positive. But here's the truth. Even a false positive leads to more testing to help keep you safe. Missing a real cancer, though, that's the outcome we want to avoid. So, accuracy is important. The film's context. The gallery is meant to be a lens for you, not a sentence. It's the starting point, not the ending.
So, how do we take this information and make a strong, empowered decision?
Good question. You could read my blog. It's called How Does It Actually Work? Demystifying the Gallery Test Process. To do that, just tap the link in the show notes, or you can find it at dr-sally.com. If this conversation opened your eyes, share it. Accuracy and fear go hand in hand, but education cuts through both. Subscribe to this podcast and let's keep peeling back the layers of modern medicine together. And if you still have questions, leave me a comment or DM me at Facebook or Instagram at Dr. Sally Official. I would love to hear what's on your mind.
Everyone I know wants two things when it comes to their health: clarity and control. And this test seems to offer both, but only if you understand it and how to use it. I'm Doreen Lorenz, asking the questions that help you turn information into action. Take care of yourself and take the lead on your health.